asking everyone if they'll agree. Okay. I'm going to go ahead and drop the agenda and the slides, Jermaine, that you shared with me today into the chat for folks to follow along with.
So we'll give it a couple more minutes, let people trickle in.
Sounds good. All right, I'm dropping the presentation as a PDF because I saved it that way because it was easier to upload that way. And here is the agenda as well. Oh wait, it's not letting me. Oh, that's weird. It won't let me share the agenda in the chat. It let me share the slides, but it's not letting me put the agenda in there for some reason. Bizarre. Okay. All right, I'm going to go back on mute and I will be here to allow people from the lobby and for any technical assistance.
Patty.
All right.
Thank you.
Hello. All right, guys, welcome to the July 9th Cultural Competency Committee meeting. Let's go in and say who we are, what company we with, and what you did fun for the 4th of July. My name is Jermaine Gregoire. I'm a staff service analyst, behavior health, admin. 4th of July, did some barbecuing, went to a couple of the fireworks shows, hung out with family. Let's go and pass it on to Megan.
Hi, I'm Megan Morgan. I'm community liaison at Lake County Behavioral Health Services. And I went to the festival in Lakeport with my stepson and then got home and got to chill out during the evening on July 4th. So that's how I enjoyed it. And I'll popcorn over to Summer Walker.
Hi, my name is Summer Walker from Lake County Behavioral Health. And I spent the 4th of July watching my cats knock everything off every surface because they were afraid of fireworks. And I'll go over to Anna Perez.
Oh, Anna Perez has no camera or microphone on her computer. She said that in the chat. So she could probably do that in her introduction in the chat if that's possible for her.
Cool. Yeah, then I'll do, let's say, Bonnie O'Donnell. How's that? Oh, okay. Or Elise.
Hi, Elise Jones, Lake County Behavioral Health Services. And I went camping on the coast, which was a nice departure from the heat, although it's been a mild summer. So just let my kids run feral at a campground and cook some barbecue, and it was just some real good old-fashioned American camping. And I will popcorn over to, I'm looking at my, oh, who's here? April, are you here? Do you want to go, or are you just listening? Or Amber Westfall? Or let's see here. Well, let's or yeah, we can do Monty. Are you there? Michelle's here. Michelle Lampkin is here. Let's do Michelle. Hi, Michelle.
What am I doing now? I'm sorry, I had to step away.
No, you are good. You're just gonna say your name, who you are, and if what you did on the 4th.
Oh. What did I do on the 4th? My name is Michelle Lampkin. I work for Behavioral Health Services. I'm the operations manager, and on the 4th, I stood out in the middle of my street and watched the fireworks from a distance. And made sure my dogs didn't run away.
Who else is here? Well, Summer was gonna call on Bonnie O'Donnell. Bonnie, are you there? Nope.
Good
Alice.
morning.
Yay!
Yay! Good morning, team. So I'm Bonnie O'Donnell. I work for Lake County Behavior Health Services. I'm part of the mobile crisis team. And what did I do for the 4th? Well, the 3rd, I watched fireworks with my grandchildren over in Canocti. And on the 4th, I just took care of me, relaxed. It was kind of peaceful, me and my dog. So popcorn over to Marty. Are you there, Marty? Okay, let's see who else is here. Patricia.
All right. Well, I am Patricia Russell. I'm a staff services analyst for BHSA programs at Lake County Behavioral Health. On the 4th, me and my whole family went down the street to watch the parade in Clear Lake because we've never missed a year ever. And then we went and barbecued and hung out at home until dark, and then we went down to the Austin Park and watched the fireworks. We kept it local. We stayed in Clear Lake the whole day, and it was super fun. And who hasn't gone yet? Mary, I see your hand up. You can go.
I'm Mary Wilson. I'm an adult education specialist housed over at Lake County campus, and I'm also on the Clear Lake City Council. For the 4th of July, I worked a booth for the college at the Clear Lake at Austin Park. And in the evening, went home and crashed. Didn't watch the fireworks or anything. I was just too tired. And I don't know, somebody else raise your hand. Somebody else go.
Good morning. My name is Marty Rodriguez, Staff Service Analyst, Lake County Behavioral Health Services. And on 4th of July, I was camping up in the Lassen area.
All right, let's try Miss Francis, Maria Francis.
Hi, everybody. My name is Marin. I'm the SUDS program analyst, Lake County Behavioral Health Services. And for the 4th of July, I watched the fireworks in Lakeport. It was very busy, but very beautiful. I will popcorn it over to Amanda.
Hi, everybody. Sorry, I'm Amanda Hicks. I'm a substance abuse counselor for Lake County Behavioral Health. And for the 4th, I just went and did had a barbecue with my family and then stayed home. It was pretty nice and easy going. Who wants to go next? Don't know who's all here.
Allison.
Allison, you're next.
I'm Allison, and I'm a staff service analyst, primarily working with DUI. I had a little barbecue at my house in Cobb with my mother and some friends. Who's next?
I can go next. Good morning, everybody. My name is Sunshine Jackson. I'm the tribal liaison at Partnership Health Plan of California. And for the 4th of July, I floated down the river that's sitting behind me with family.
All right, let's go Anna Perez.
Anna Perez put hers in the chat. She doesn't have a microphone on her computer, but she's a peer support specialist with Lake County Behavioral Health, and it looks like she was camping as well. A lot of campers this 4th.
All right, that's it. Chrissy.
Hello, Christine Andrews, Lake County Behavioral Health. I spent a lot of well-needed time at home playing in my garden and doing local parades and fireworks. Marin?
She went. I think that's it. Megan, did you? Yeah, Megan went. Okay. All right. Well, let me share my screen. Oh, Scott. Yeah, Scott Abbott.
Hi,
Scott's final one.
Yeah, I'm Scott Abbott. I'm from Lake County Behavioral Health Services, and I spent the 4th exploring my new house. Didn't have a chance to find any local 4th of July festivities.
All right. Thank you guys for being here and introducing yourselves. Let me share my screen. So welcome to the July 9th, 2026 Cultural Competency Committee. Today we'll cover key disparities facing our Lake County community, honoring the significance of Juneteenth, examine the ongoing reality of racism in America, and explore how DHCS BH Connect plan can benefit our small community. So thank y'all for being here. The land acknowledgement, we acknowledge that Lake County rests on the traditional, ancestral, and unceded lands of the Pomo, Wapo, Lake Miwok peoples, Big Valley Band of Pomo Indians, Robinson Rancheria, Elam Indian Colony, Scotts Valley Band of Pomo Indians, Upper Lake Pomo, Middletown Rancheria Pomo Indians. We honor their enduring presence, resilience, and cultural wisdom that continue to shape our community. So this honors the indigenous people whose land we occupy and reminds us that historical drama connects directly to present day health disparities that we address today. So this is the agenda: welcome, land acknowledgement, introductions. We can talk about the purpose of the CCC, Lake County at a glance, key disparities, vulnerable populations, Juneteenth history, mental health, and why it matters today, racism today, data, health impact, and what can Lake County Behavioral Health Services do. DHCS BH Connects overview and benefits for Lake County, structural barriers, community strengths and recommendations, open discussion, and next steps. So the purpose of the Cultural Competency Committee, promote equity, advance culturally responsive behavioral health services that meet clients where they are in their language and cultural context, identify disparities, track and address gaps in access, quality, and outcomes across the populations we serve, strengthen workforce, build cultural humility and competency among Lake County Behavioral Health Services staff and contract providers through ongoing training.
I only mentioned your sense of harshness, and I was like, you fucking call your brother that?
Bonnie, get on mute.
So build partnerships, support collaborations with tribal nations, faith communities, schools, organizations across Lake County, and advance BH Connect, align Lake County Behavioral Health Services with DH CS state transformational goals, and leverage new funding under the BH Connect initiatives. Lake County at a glance, community in need, population 68,000. We rank like last in health of all our counties in California. Almost 18% poverty rate, life expectancy 74 years, poor mental health 20%, depression rate almost 26%, 3 times higher suicide and substance use versus California average, and unemployment rate 6.7%. So, and this is our neighbors. So it's people that deserve equitable care. Vulnerable populations facing disparities in Lake County. People of color, Black individuals, homeless rates double the county average. Sorry, my dog is going off over here. American Indians, Alaska Native, 3% of the population, with 21% of homeless. African Americans overrepresent the emergency service use. Unhoused individuals, Lake County homeless rate is 89 per 10,000, nearly 2 times the state rate. Over 4,300 Medi-Cal members identify as homeless. Children and young adults experience homelessness at 3 times the state rate. We have older population, almost 25% of the residents are 65 years plus. Many age in isolation in rural areas with no transportation or broadband. Shorter days intensify depression and loneliness, and we have a high Medicare spending per capita. LGBTQIA2S plus individuals face stigma and discrimination in conservative rural environments. High rates of depression, anxiety, societal ideation, very limited access to affirmative providers in Lake County. And veterans, we have over 4,700 veterans in Lake County. Nearly 1 in 3 homeless veterans are chronically homeless, PTSD compounded by wildfire trauma and poverty, and limited VA services. And so a lot of these people are in, multiple categories. Intersectionality compounds vulnerability. Example, a Black veteran experiencing homelessness faces compounding barriers at every level of care. So the reason I'm talking about Juneteenth again, because this past Juneteenth, Bi-Coastal posted a post saying Happy Juneteenth. And the comments was just outrageous. People was mad because saying why Black people getting a holiday. And saying things like, well, my family came from Ireland, or my family came from all these different places, they should get a holiday. The difference is their ancestors did come here looking for a better life, and it probably was hard, and they made it through. The difference between that and the Africans, because the Africans was stolen from their home, over 4 million died fighting not to get on the ship, to get on the way to the ships, and another almost 2 million died on the transatlantic journey. I had an elder from another nationality tell me that the Blacks just gave up and became slaves. They people would have fought to the end. Over 6 million people died fighting trying not to be slaves. And then for nearly 400 years, they dealt with severe drama. So June 19, 1865, Union troops arrived in Galveston, Texas, announcing the freedom of over 250,000 enslaved Black Americans. 2.5 years after the Emancipation Proclamation, Juneteenth became a federal holiday in June 2021, 156 years after the first celebration. It's the oldest nationally celebrated day of commemorating the end of slavery. So it's not like a regular holiday. This commemorates the end of slavery. So it's a difference. To celebrate, to educate, to agitate, historian Mitch Kacken. Connection to mental health. Historical trauma, slavery, segregation, racial violence, create multi-generational trauma that's still felt today. Racial battle fatigue. The ongoing stress of navigating structural racism impacts physical and mental health. Post-traumatic slave syndrome spans the atrocities of slavery to mass incarceration. Symptoms include homelessness and depression across generations. So Juneteenth as healing, celebrating cultural identity, community, and resilience itself is a powerful mental health intervention. So Juneteenth is deeply meaningful and directly relevant to our work in behavioral health equity. Freedom was not delivered on the day of the Emancipation Proclamation. It took over 2 more years to reach Texas. This delay is a metaphor for the ongoing delay in justice, in health, housing, and economic equity. Historical trauma is not just a concept. It lives in the bodies and minds of our Black community members today. Juneteenth and Black mental health, the work continues. Black Americans are 20% more likely to experience serious psychological distress than the general population. Yet only 39% of Black adults with mental health illness receive services, compared to 58% of white adults. Only 25% of Black Americans seek mental health care, compared to 40% of white Americans. Barriers include cultural stigma, historical mistrust of medical systems, and a lack of culturally responsive providers. The rates of PTSD and psychosis are higher in Black communities, linked to the social, economic inequality and chronic discrimination stress. These conditions are compounded by racial trauma from daily lived experience of racism and microaggressions. Major depressive episodes increased among Black youths aged 12 to 17 from 9% to 10.3%. And the young adults 18 to 25 from over 6% to 9%. And that was between 2015 and 2018. So rarely any of us heal in isolation. Healing is an act of communion, quote from Bell Hooks. July is BIPOC Mental Health Month, honoring the work. Each year, the U.S. recognizes B.B. Moore Campbell National Minority Mental Health Awareness Month, widely known as BIPOC, Black, Indigenous, and People of Color Mental Health Month. A time to center the mental health strengths and challenges of communities of color. Origins and meaning. Established by Congress in 2008, honoring author and advocate, B.B. Moore Campbell, co-founder of NAMI, Urban Los Angeles. Campbell fought to end stigma and expand culturally responsive care in Black and other underserved communities until her death in 2006. BIPOC Mental Health Month is now widely used to center identity and lived experience over the term minority. Why it matters for Lake County. Only 39% of Black adults with mental health receive care versus 58% of white adults. BIPOC communities face stigma, historical mistrust, and shortage of culturally responsive providers, acute in rural Lake County. This ties directly with the CCC priorities, recruiting providers of color, anti-racism training, and equity observances year-round. Why is racism still prevalent today? Even though many people will say that it's not. Structural and systemic racism. 1.63 million excess deaths among Black Americans relative to white Americans over the past 2 decades. That's over 80 million years of lost life. Black Americans face 30% higher maternal mortality rates. The U.S. healthcare system, by its very design, delivers different outcomes for different populations. Black Americans are less likely to have health insurance and report widespread discrimination by healthcare providers. Even diagnostic tools and clinical algorithms may fail people of color. Racism as a health crisis. CDC 2024, repeated exposure to racism and discrimination increases risk for depression, anxiety, hypertension, and heart disease. Racial battle fatigue, chronic stress from navigating racist systems depletes physical and mental health reserves. In Lake County, African Americans overrepresented at the emergency behavioral health services use. Structural barriers in housing, employment, and criminal justice multiply the health burden. Over 20 years of public pledges, no measurable progress on racial health equity nationwide. So we have to acknowledge that racism is a difficult topic, but our committee exists precisely because these disparities are real and harmful. And this is brought in the data, not opinion. So structural racism is recognized as a public health crisis. Responding to racism, what can Lake County Behavioral Health Services do? Require mandatory implicit bias and anti-racism training for all Lake County Behavioral Health Services staff and contacted providers annually. We do this already. Online trainings. I think we should have some in-person trainings on that subject, but we do provide training for our staff. Recruit and retain Black, Indigenous, and other providers of color through a pipeline program or competitive compensation. Yeah, that's something we need to work on. Implement race, LGBTQIA2S plus data collection into all Lake County Behavioral Health Services programs to track and close disparity gaps. Develop culturally responsive outreach material co-created by community members of color, not just translated versions. Establish safe reporting mechanisms so clients of color can report discrimination experiences without fear of retaliation. Partner with faith-based organizations and trusted community leaders in Black and Indigenous communities. We do this. The COC takes care of a lot of things, a lot of these areas. Align programming with equity observances year-round: Juneteenth, Indigenous People Day, Pride Month, National Hispanic Heritage Month. We do newsletters for all these events. We have booths at many of the events. Maybe we should do something for the next Juneteenth one. DHCS BH Connect. What is it? BH Connect as behavioral health community-based organized network of equitable care and treatment. It's a 5-year Medicaid Section 1115 demonstration approved by CMS in 2024. It is California's most significant behavioral health transformation initiative designed to expand medical health services for individuals with significant behavioral health needs, including rural counties like Lake. Expands services, expands the continuum of community-based services, evidence-based practices available through medical health for adults, children, and youth with significant behavioral health needs. It's a $1.9 billion incentive fund, access, reform, outcome incentive programs, rewards behavioral health plans for improving access and outcomes, and unprecedented investment in behavioral health transformation. Workforce support funds training, recruitment, and retention of behavioral health practitioners across full continuum of care, directly addressing rural provider shortages like Lake counties. Children to families, strengthen family-based services and support for children and youth, including those involved in child welfare, protecting Lake County's most vulnerable young people. Community transition. Support adults 21 plus returning to the community from institutional settings, preventing rehospitalization and supporting recovery in the least restrictive environments. BH Connect is approved and currently rolling out statewide and builds on CalAIMS and represent a massive opportunity for Lake County Behavioral Health Services. Key message, Lake County, I'm not sure if we opt into all the options as of yet, but the community can be a powerful voice for advocacy to ensure the most vulnerable community members benefit fully. BH Connect, how can it benefit Lake County? Assertive community treatment, mobile intensive wraparound services for highest need clients, including unhoused individuals who cannot reach clinic-based care. Directly addresses Lake County's crisis, 89 homeless persons per 10,000, which is nearly 2 times the state rate. Enhance community health worker services, trusted community members, bridge cultural gaps, and connect people of color to services in their own language and context. Critical for Black, Indigenous, and Latino ex-farm workers and LGBTQ plus populations in Lake County. Individual placement and supported employment, evidence-based competitive employment for people with serious mental illness. Lake County unemployment is at 6.7%. Stable employment is a key social determinant of mental health. Coordinated specialty care for first episode psychosis, early intervention, matching Lake County's existing youth-focused prevention programs. Youth ages 18 to 24 already identified as the highest risk group in Lake County disparity data. Workforce development funding, scholarships, stipends, loan repayment for behavioral health practitioners serving federal designated shortage area. Lake County is a federally designated mental health shortage area, so funding is available. Community transition and reach. Support adults leaving institutions and reconnecting with community, reducing recidivism and rehospitalization, especially important for veterans and individuals with justice system involvement in Lake County. Structural and cultural barriers to care in Lake County. Structural barriers, long distance to clinics, poor road access in rural areas, digital divide, limited telehealth with 15% of households lacking broadband, only 13 primary care providers, physicians within per 100,000, and the national average is 42. Severe provider shortage and high workforce turnover. Economic instability, almost 18% poverty. 62% rent burden renters. Wildfire trauma compounding PTSD, anxiety, and housing instabilities. Cultural barriers. Stigma and lack of privacy deter help seeking in small communities. Distrust of government systems, especially among Black and Indigenous communities. Limited culturally and linguistically competent providers. Historical trauma persists in the tribal communities. Self-reliance culture emphasizes endurance over help seeking. And language barriers for Spanish-speaking farm workers, which is over 25% of the population. So the barriers our community faces are not individual failures. There are system-level problems requiring system-level solutions. BH Connect solutions, we should use them when possible. Barriers can be discussed in working groups. So whenever we need to start really talking about this a little bit more. Cultural strengths and community resilience in Lake County. Tribal health programs. The tribal nations provide culturally grounded, community-based care rooted in indigenous healing traditions. Faith-based networks, churches, and faith communities across Lake County offer trusted social support, crisis response, and informal counseling. Peer advocacy. Peer support specialists with lived experience serve as powerful bridges between the system and underserved populations. Community resilience after disasters. Lake County has demonstrated extraordinary cohesion and mutual aid following devastating wildfires. Cultural celebrations is healing. Juneteenth, Hispanic Heritage Month, Indigenous People Day, and pride events build community, identity, and mental health. and mental wellness. Lake County Behavioral Health Services, BHSA, full service partnership, existing intensive support programs, demonstrating measurable outcomes for the county's most vulnerable residents. How's everybody doing out there? I feel like I'm just talking. Everybody all right? I heard we had some things popping in the chat. I couldn't see them because I got too many screens open. But opportunities, recommendations, next steps. Advocate for Lake County to opt in all available BH Connect evidence-based practices, especially the ACT, IPS, and community health worker services. Develop a cultural responsiveness action plan specifically addressing Black, Indigenous, and Latinx communities in Lake County. Expand telehealth infrastructure and mobile outreach to reach rural residents without transportation or reliable broadband, which I think our crisis team pretty much handles that. Implement trauma-informed, culturally responsive staff training with anti-racism as a foundational, non-optional component. Create a formal Juneteenth awareness program within Lake County Behavioral Health Services, client programming, staff education, and community engagement events. Establish partnerships with tribal nations to co-develop and support indigenous-led behavioral health and traditional healing programs. Strengthen data collection by race, ethnicity, LGBTQIA2S plus status, and veteran status to systematically track and close disparity gaps. Some discussion, community steps, next steps. So how can Lake County Behavioral Health Services currently, how are we currently serving our Black community members? And what specific gaps exist in cultural responsiveness? Any thoughts?
Really quickly, Jermaine, I want to address the things in the chat that you couldn't see.
Okay.
Elise said that Lake County has not opted in at this time for BH Connect. However, it should be noted that ACT is required for the behavioral health transformation under Proposition 1, as is supported employment. And we do already have a coordinated specialty care program for individuals with early first episode psychosis. It's the Early Intervention Services offered by LCBHS. Since you couldn't see it, I wanted to get that out there.
Thank you.
Sorry, didn't want to interrupt, but there it is.
All right. So back to that. The next question was what steps should we take to advocate for Lake County to fully participate in BH Connect's evidence-based practice expansion?
So I can speak quite a bit to that.
Okay.
Actually, leadership has thought extensively about and opting into BH Connect. It's a waiver under Centers for Medicaid, which means that it's like an extra set of services that the federal government approves, and specifically BH Connect provides for all-inclusive encounter rates for various service modalities. It's really important to note, though, that Proposition 1 behavioral health transformation requires nearly all of the same service sets as BH Connect. So we're required to do assertive community treatment. We're required to do individual supported employment. We are also required to do high fidelity wraparound. Early psychosis, we actually have had a grant for that I wrote back in 2022 that we are concluding that work. The challenge with these models is that you must implement them to really high fidelity standards. And typically that's incredibly difficult for small rural counties for the reasons that you've stated, which are a lack of healthcare providers in the area. And so because there's already such a heavy lift with regard to what's minimally required through behavioral health transformation, we've decided to focus on what's absolutely required of us and then continue to evaluate the capacity we have to opt in to get another additional waiver such as BH Connect.
Thank you. How can we meaningfully honor Juneteenth within Lake County Behavioral Services as both an operational, organizational observance and a community health service? So I know we do post the newsletter for all these cultural holidays, and we do booths at a lot of events, but I haven't seen one in none of the Juneteenth events. I think that's something we should opt into, if possible. Any comments?
I would just note that the county itself has, for the past several years, done a proclamation to honor Juneteenth. And so we could advertise that to staff who might want to tune in. That's just something that is already existing. That's all I can think of.
I think there could be a way to one or more of the Juneteenth events acknowledge the impact of historical trauma on the on our Black population, and have kind of an information with some of the statistics and things that Jermaine is talking about. It is barely it only raises awareness. It doesn't do the next step, but I think you have to start with at least awareness.
Thank you, Mary.
And at the Pride event, the museums had an exhibit about LGBTQ history in Lake County, and I asked them if it was ever on exhibit anywhere else, and they said not, but at least it was on display there. So we could think about these events that are about identity and have a similar exhibit.
That event was pretty cool too. I ended up going over there. It was a lot of people. It looked like it was a lot of fun. People had a good time. No drama. But that was cool.
It was.
So which partnership, tribal nations, faith communities, LGBTQIA2S plus organizations should be the community's highest priority for the next 6 months?
So I can provide some context that at least since I've been in leadership in the department, engaging our not just our federally recognized tribes, but also outreach to people who identify as tribal members or indigenous, but may not be affiliated with the tribe. So to that end, leadership does attend monthly meetings hosted by Big Valley Rancheria to talk about community safety. We've worked really hard to make sure that our tribal partners feel comfortable contacting Mobile Crisis, because Mobile Crisis will go anywhere we're called, including a reservation. We also did award $1 million in opioid settlement funds to Kanokatai Native Wellness to do culturally focused prevention work with youth who might be at risk for opioid misuse. So in our opioid settlement funds expenditure plan, that was a really big project. Tribal communities came up to the top as long as youth, and then the intersection of tribal youth as really important populations of focus. We basically continue to outreach and to partner with anywhere we're invited, and to engage, especially tribal providers who may become interested in becoming a provider of behavioral health services. That's definitely at the forefront of our minds.
Thank you, Elise. And what additional workforce recruitment and retention strategies are most needed to address the federal designated provider shortage? So I know we have the funds that's cover tuition for people that's going back to school, for any mental health or nursing or elder homes with substance use. You get paid to go to school for that, man. So you should take advantage. Uh, I had messed up because when I was getting back in school, I didn't realize that they would only reimburse for those type of jobs. I thought just because you work with behavioral health, they would cover the tuition. So because I do business classes, mine is not covered. So for anyone that's thinking about going back to school and moving on up, make sure that you check in with HR. I check in with April because she know everything you need to know about getting these funds for school. So take advantage of it. All right. Advancing cultural competency at Lake County Behavioral Health Services. So strengthen cultural humility across Lake County Behavioral Health Services. Champion Juneteenth and equity observances. Leverage BH Connect for Lake County. Build community partnerships. Rarely are any of us healed in isolation. Healing is an act of communion. Quote by Bell Hooks. That's the end of my presentation. Did I stop sharing? I think I did.
Yes.
Yes.
All right, so I did a presentation, but the main reason we have this meeting is for the community to talk about what's going on, what can we improve on, and this is a platform for you to say what you have to say, have any questions to talk about it without any kickback, long as we are, respectful. But what you want to talk about? Oh, nothing, huh?
Hey, Jermaine, this is Allison. I have a question for you.
Okay.
Does it feel like we're making progress over this past fiscal year?
And what context?
Of being more culturally competent, our efforts are reflecting benefits and healing?
This is something I go through a lot, but it's like in waves. People make efforts for a moment, and then things fall back into the way it normally is. I know we all would like to think that we're culturally conscious and we respect everybody, but the real is, even when you don't think you are, is people. So the way I grew up, the way a lot of Black people grew up, and the things they seen are the things that indigenous people, the tribal nations, seen. Somebody from a white community haven't seen those things. So when you say things that mean nothing to you, it could be really impacting a person of color. So I think it was getting better. It was getting better for a minute, but then certain events and certain administrations brought brought this thing back out where people just feel emboldened to just say the things that they've been holding back for years. So is it getting better? I mean, I can't really say it is. So I don't know. Anybody else have any comments on that? Anybody feel any differently? I mean, so this is a free space. Say what you think about it. That's why we're here to listen and learn and try to improve things. So that's my opinion. If anybody else got an opinion, let's talk about it. Huh? There it is. Mary, you got some thoughts. I know you do.
I know. So I've been doing this work for more than 5 decades. And I feel like we're slipping backwards, and I feel like there's folks that and sometimes it's me included, that we get complacent, go on with our life, and don't notice what's going on around us. That our brothers and sisters have to be afraid for their lives every day. I had a friend move to Panama over this administration coming in, and he said he did not feel comfortable as a Black man in Lake County all the time he's lived here. So I feel good that we're here talking about it, but we're not really talking. I mean, what my observation is Jermaine has put together a presentation. He's, don't take this badly, brother, but it's like you're talking at us, and nobody is engaging on the other side. And I know this is difficult work, and putting ourselves out there. Having the courage to ask Jermaine this question was amazing. So thank you for asking. Because most of the time people are like, I'm not going to say anything because I'm going to look stupid. I don't want anybody to think I'm racist. We're all recovering racist, by the way. I just want to say that, because this is the pond we live in. It's a big racist pond. It's a big oppressive pond. And my opinion is there's a new bunch of pollution in it.
Thanks, Mary. Yeah.
Are there any activities online that we could do as groups, like pretend half the group is a minority, half the group is white, and go over scenarios? Because that'd be informative. As you said, unless you're a minority, you don't know the treatment that they're getting.
Back when there was no research ethics in the 70s and 80s, people did a lot of fascinating studies, very much like that. I did post, and I don't disagree, and I really agree with the need for in-person training, and I recognize that that's something that's been lacking across the board, not just with cultural competency, but all of them. So that's definitely hot on my agenda, is to boost in-person trainings and engagement, because it's just better. It is. Not that online doesn't have its place, but one fun fact about me is that I've been teaching at community college at Mendo College for 10 years, and I teach intro, social psych, biological psychology, psychology of gender, and abnormal psych. And every single course that I have, the foundation of it is that this is an overlay on top of white supremacy. And there is no way that in any way, shape, or form you get out of the water that we're swimming in, which is white supremacy, right? And it colors everything. And everybody, not just people of color, my humble opinion is that everybody suffers from white supremacy and colonization. It's something that harms all people, some people more than others, right? Obviously, there's interest in maintaining the status quo and power dynamics and hierarchies. But I guess that's my personal position, and something that I do in my academic work is every single topic that I teach about, there first we have to address white supremacy. Like, it doesn't, you can't get around it. It's foundational to everything. So that's, I think I did post, just for your fun edification, there's a test about implicit bias that's incredibly well researched. It seems silly, but if you want to take it and learn about ways in which you may have implicit bias towards any particular group of people, it is very well researched to show those biases. And obviously, going into any of the helping services work, assume that you have implicit biases. And I guess that's the biggest thing that we can do, is don't get married to an opinion, right? Be curious and be willing to hear other sides of things. That's probably the biggest antidote that we could have against ideological white supremacy and colonization. So, for whatever that's worth.
And I always said to my students, you need to be comfortable with discomfort.
Yes. Mm-hmm. And also, a lot of people with privilege interpret accountability as hostility, right? Because we guard privilege so tightly. And so, to people who look like me, who are not a person of color, right? Like, we do have privilege. And so it's one of I consider it a sacred obligation, really. Like, one of my highest callings is to use my privilege as a co-conspirator to lift up others who can't say what I can say, right?
So, since I got one more thing, like so ask yourself, because I'm gonna tell you the most hated person in America is the black man. Say, I mean, people could what I'm saying, argue that if they want to, but ask yourself, you got a daughter, and she's bringing home a black guy. How you feel about it? Because I've experienced a lot of my time in California. Because I'm from Louisiana. I've been to California over 30 years, and from what I've experienced, and it's not just white folks, man. It's like so other say minorities who have feelings about black people, especially the black man, and they guarantee to tell their daughters, "Don't you bring that black man to my house." I've seen it firsthand many times, so just something to leave you guys with. Anybody got anything else?
The Middletown Art Center has been doing all kinds of cross-cultural work for the we've been for more than 5 years. And we had the first exhibit curated by a Native American in Lake County that had about 30 artists in it. We it took us 2 rounds to get the grant for the water baskets that are up on Rabbit Hill. And part of the reason we had to do the second round was because the first round, California, the granting agency said, we have to make sure that you are in right relationship with tribes in order to do this work. We did Harlem Voices, which was a concert symphony by Clovis Lewis. We've been doing different like Christmas events and other things with the Latinx community. We actually had the first Juneteenth celebration in the county. We just did our 6th. And so I'm going to urge you, I think I can put the picture yes. So I'm going to put this, one of the projects we're working on right now is in the Oaks. That there's a significant amount of tribal material in this mural project that's going on, and you can learn things about even the fact that we're not really good about working across generations. In our culture, we tend to stick to our own age set, and this project is mostly done by youth, and some of them are tribal, some of them are queer. So I put that in there, and I urge you to go and to one of the events, because it is a way to just touch outside your comfort zone. You don't have to go to a protest. You can go to a celebration. And also, look at people can look at Swim's Facebook page and see what they're having, what the kind of celebrations they're having. They had, I think it was their 2nd annual Juneteenth this year, right? Okay. So look at that as well.
Yeah, that was pretty nice, the Juneteenth celebration
Yes,
they had.
Mm-hmm.
All right. We have no other comments, no other topics to jump on. I guess we'll cut it short today. Everybody good? All right. Well, everyone have a wonderful day, a great weekend, and I'll see you when I'm in the office.
Thanks everybody
Bye.
for being here.
Thank you.
Thank you.
Jermaine.
This recording of this meeting will be sent out. So watch for that and have a good day, everybody.